creatinine is rising, urine output is dropping, potassium is creeping up, and the family says he barely peed today. Is this AKI or CKD? The nurse does not guess. The nurse asks one simple question. Did this change suddenly, or has this been happening over time? Our first patient has been vomiting for 2 days and barely urinating. His legs look swollen, and the family says he is much weaker than usual. I'm checking urine output, creatinine trend, potassium, fluid status, medications, blood pressure, and previous kidney function.
AKI means acute kidney injury. Think sudden kidney stress, maybe dehydration, sepsis, or low blood pressure.
Urine output may fall, fluid can build up, and potassium can become dangerous.
The timeline is the biggest clue. This looks chronic rather than sudden. Protein or albumin in the urine is also common.
Here's the memory trick. AKI asks, what changed today? CKD asks, what has been happening over time? The labs help tell the story, but never interpret one number alone. Look at creatinine, eGFR, potassium, and bicarbonate together.
Also check hemoglobin, calcium, phosphorus, and urine studies. AKI is a sudden change. CKD is a long trend.
One of the most useful bedside clues is urine output. A sudden drop signals a change in kidney perfusion or filtration. That is why accurate intake and output matters. Ask, how much have you urinated today compared with normal? The nurse also checks for signs that the kidneys are not managing fluid well. I'm checking your lungs, swelling, and blood pressure. We track weight and breathing effort. Daily weight is one of our best indicators of fluid balance. Kidney changes affect medication safety. The nurse reviews recent contrast exposure and medications that may affect function. We verify which medications require renal dose adjustment or additional monitoring when function changes. Doctor, I'm calling about room 8. Decreased urine output, worsening edema, and rising creatinine and potassium. I'm concerned about AKI. Understood. Continue strict I and O and cardiac monitoring. I'll report any worsening urine output or breathing changes. Kidney care is a team effort. The nurse catches the pattern, the provider finds the cause, and pharmacy prevents harm.
AKI means a sudden change in function. Depending on the cause, it might improve as the underlying problem is treated.
CKD is different. It's damage that persists over time. We compare today's labs with the old ones to see the baseline. After treatment starts, reassess. Is urine output improving? Is potassium stable? Is fluid overload better or worse? What is the creatinine doing? Kidney care is never just check one number and walk away. Trend the labs.
Escalate quickly if the patient develops dangerous potassium changes or worsening shortness of breath. Quick recap. AKI is sudden. CKD is chronic. AKI shows quick changes in creatinine, urine, and potassium.
CKD shows long-term reduced function and protein in urine. The trick is connecting the whole clinical picture. Remember, AKI asks, what changed? CKD asks, what has been happening? Watch the urine and trend the labs.
Join us at the Nurse Scrub Club, where we make complex nursing topics simple, visual, and memorable. Don't forget to like, share, and subscribe. Bye for now.